So we are launching a NRAS Wellbeing Exercise group. So here again, it's anyone that has the same interests as you, wanting to, if you're already quite physically active or you're wanting to get back into it, I think this would be a great place to go. But if you obviously do like the sound of this, or after the whole event, you then feel like you would like to hear more about it, and have the chance to meet online with other people across the UK, please email wellbeingexercise@nras.org.uk, which is on the screen now. Again, you'll hear from fitness and wellbeing experts and have the opportunity to take part in some live exercise sessions as well. Ayesha was diagnosed with RA in 2010, so she does have it herself, and is a fully qualified personal trainer with her own successful businesses, and she specializes in resistance training. And in this video, she'll just be showing you a few simple exercises that you can do from home.
Hi everyone, my name is Ayesha and I'm a personal trainer. I have rheumatoid arthritis as well. I've been living with rheumatoid arthritis for about 11 years now. One of the things that I found has really helped my condition is using exercise for health. The type of exercise I tend to perform and what I teach my clients and what I promote is resistance training. So we're working with weights. Resistance training can also be performed body weight only. Through the years, I've progressed to barbells and dumbbells and so on. I'm going to show you two exercises today. I've been asked to demonstrate a couple of exercises that you can do at home. So I'll show you one exercise for the upper body and I'll demonstrate exercise for the lower body as well. The upper body exercise I'm going to show you is called the shoulder press. So when we use resistance training, what we tend to do is we do a warm up and then we do a dynamic stretch portion. So the idea of the warm up is to get the heart rate above your current rate. Easy warm ups you can do at home is walking on the spot, do some high knees, do some side jacks. These are the low impact version of jumping jacks. So you can do these as well. So maybe do that for 3 or 4 minutes, just to get the heart rate slightly elevated, get you above resting heart rate. Now, if I were to perform, I'm going to demonstrate an upper body exercise first. And before I do the upper body exercise, I would want to make sure I've dynamically stretched. So if the exercise that I'm going to show you for upper body is called the shoulder press. So a couple of exercises you can do, dynamic stretches you can do before moving to the lift is some nice arm circles. So when we do arm circles, I'm taking in a clockwise fashion, and I do about 10 repetitions. I increase the size of the circle during those 10 repetitions. Another dynamic stretch I would use is your arm swing. So you take your hands together all the way back and swing those arms around, and you'll feel the work through the shoulder joint and the upper back. Okay, and you would do that for 10 repetitions. Now, the shoulder press, the first exercise I'm going to show you, you can use home items. So you can use the pair of cans. I will demonstrate a couple of sets for you. The first set I will do with the cans. Second set I will do with the dumbbells so you can see the difference. So you could start with, I've just grabbed a pair of cans for my kitchen. Okay, so let's talk about body positioning. I take my feet are about hip width apart, so I've got a nice stable base. When I do a shoulder press standing, I am now getting to use my core. So first thing I do is imagine my belly button is pulled in towards my spine. So I've got a nice strong core here. Now I'm standing on my feet, my body is stabilizing. I take a can in each hand, and the way I've held it is I've just put my hands around the can there. I'm going to bring my arms up. Now I'm going to take my arms so you can start at a 90-degree angle. I like to start a little bit slower, a little bit lower, so that I get a greater range of motion. I'm going to hold these cans here, and I'm going to go for, let's say, about 10 repetitions. And all you're doing is pushing up directly overhead. So it's going to look as follows: 10, 9, breathing out on exertion, breathing out on the way up, inhaling on the way down, 6, 5, So you would go for 10 repetitions. 10 repetitions is a good number. It's a nice high number. The weight is nice and light. What you would do is maybe 10 repetitions and 3 sets. The benefit of the shoulder press, so primarily you're working the anterior deltoid, so the front of your shoulder. And remember, compound moves, so we do perform actions overhead, whether you're going to grab a plate or a cup overhead from your kitchen cupboard, or you need to put something, I don't know, on an aeroplane when you need to put something up overhead. So this is a movement that we use in real life. The good thing with the shoulder press is that it's a compound exercise. So alongside working the front of our shoulder, our back is coming into play. You've got a muscle group, they're called the trapezius, and it's a diamond-shaped muscle group. It runs from like about here down to about the mid-back. So your trapezius is coming into play, your biceps, so the fronts of your arms here, and your triceps are always also working to stabilize. At the back of your shoulder is called your posterior deltoid, so your rear deltoid, that's coming into play and helping you to stabilize also. It's a great little exercise, it's a compound move, so you're working multiple muscle groups. When you're standing, your core is engaged, so you're getting a workout also from the core as well. So if you become comfortable and proficient at using cans, you can then progress to dumbbells. I'm just going to show you dumbbells. So with dumbbells, you want to practice safe lifting. So the dumbbells are in front of me. I'm going to bend, so I'm going to push my bum back. I'm going to bend through the knees to grab these dumbbells. I brought them here. Now I'm going to bring one dumbbell. I'm going to put it here on my shoulder. The other dumbbell is going to go here. It's the exact same exercise performed. I'm going to bring my arms out and I'm going to push up, breathe out on the way up, inhale on the way down. Inhale. Exact same principle. You don't have to worry about the dumbbells exactly touching. We're just bringing them overhead. Now, when you first start this exercise, if you do progress to dumbbells, you can also do it seated, so you can sit down and you can perform the exercise here. When you're seated, you've taken out some of the core work now, so the exercise is a little bit easier. You can focus more on the push and the exercise being performed. So that's the first exercise, that's your shoulder press. Great exercise for the upper body and the back. It comes into the upper body. The next exercise I'm going to demonstrate is a squat. So there are so many variations of a squat. You can have a narrow stance squat, a sumo squat. We can use barbells, dumbbells, body weight only. You can use bands. So there's a lot of variety when it comes to the squat. The one I'm going to show you today is just a narrow stance squat. Just going to tilt my laptop ever so slightly so you can see foot positioning as well. Okay, brilliant. So for the narrow stance squat, what we're doing is we're keeping our feet slightly narrower than hip width apart. By keeping my feet in this position and my toes pointed outwards, I'm going to hit the quads. The quadriceps, the quads are the fronts of the thighs. When you perform this exercise, you're going to keep your feet together. Chest forward, eyes are forward. You'll see my eyes as I come down, and you're going to squat down, squat down. So you're pushing that bum back. There's a bend through the knee, and you go low as you're comfortable. If you go, the lower you go, so if you break below parallel, the more knee recruitment you get. So if you're having a day where perhaps your knees are flared and they're not feeling great, just go for a shallow squat. By shallow squat, it can look like this, and you can come back up. If you're feeling good, go for a deeper squat. You get more knee recruitment. The deeper you go in the squat, the more glute recruitment you get as well. So the bum, the muscles in the bum begin to recruit. So once again, maybe go for 10 reps and 3 sets. So you're here, inhale, 2, 3. When you get used to that and that becomes easier and more comfortable for you, you can start adding weight. So I could repeat the same exercise. So this is about 5-6 kilo here. Put the dumbbell against your chest, keep your feet together, and go down again. And once again, use the same cues. So if your knees aren't feeling great and you don't want as much knee recruitment, just go shallow, come back up again. Shallow, come back up again. 10 reps and 3 sets is a good starting point. So we've got enough repetition. We tend to go higher repetitions when we want to build some muscle mass and we're using lighter weights. As time goes on, if you want to look at building more and more strength, we can then start adding more weight and using lower repetitions. Your squat is a fantastic exercise. So it's a full lower body workout. You're getting an upper body workout as well because you're having to stabilize this core as you're coming down. Predominantly, we're hitting the quadriceps, the fronts of the thighs. The glutes are coming when you're breaking blood parallel. Your glutes, your muscles are going to play as well. A few other keys you want to be mindful of. So toes are pointed forwards. When you're coming down, be mindful of not letting the knees cave in. So as you're coming down, don't let them cave in or don't let them rotate outwards. So a couple of cues that you need to be aware of. Squats, once again, compound move, functional exercise. In real life, we do bench, pick things up and so on. Great exercise for strengthening this muscle group. And we know we want good, strong quadricep muscles if we do have arthritis. If, in the future, it does affect our joints. We want the supporting muscle groups to be able to take as much load off that joint as possible. I hope these exercises have helped. I'm sorry I can't be with you live today, but if you have any questions, if you pass them on, and then I'll try and answer them as best I can. Okay, thank you so much. Bye.
So I will now actually pass over to Professor George Metsios, Professor in Clinical Exercise Physiology at the University of Wolverhampton. I'll just pass over to George.
Thanks very much for the invitation. Thank you very much, Emma. Hi, everybody. My name is George. As Emma said, I'm a professor in clinical exercise physiology, and most of the work that I've done has focused on exercise and physical activity in rheumatoid arthritis. So not only I've done research on rheumatoid arthritis, but when I was a student, a PhD student, and later on during my postdoc, I have been in the gym with people that have rheumatoid arthritis. So I do have hands-on experience on this area. And later on, it was really nice to do research on physical activity and actually apply all this knowledge into practice. That's a very brief background. So can I share? I can share my presentation, can't I, Emma? First of all, I would also like to say that because due to COVID and being inside, we're working from home. I'm working from home. So if you hear any screams for the kids, I do apologize in advance. These are the joys of working from home. Right. Okay. Yeah. We can go straight to the second one. Yes. Click everything. Yeah. So that we can see everything on this slide. Yeah. So first of all, the reason why exercise and physical activity are important are because sometimes in some people living with rheumatoid arthritis, medication is not as effective. So, for example, we know that approximately 20 to 40% of people living with rheumatoid arthritis that start anti-TNF medication fail to respond. We also have people that have side effects from medication, and in some cases, other types of treatment is not as effective as we would like them to be. So the recommendations from the European League Against Rheumatism have started to recognize all the evidence that we have in the last 20 to 30 years around physical activity, exercise, and rheumatoid arthritis. So they are strongly recommending physical activity and exercise for better managing rheumatoid arthritis. But before we start and go into the benefits of physical activity and exercise, what I would like to do is make a distinction between those two terms. Physical activity is any bodily movement that comes from our muscles and increases our energy above resting levels. And examples of physical activity are walking, hoovering, and gardening. Exercise, on the other hand, is part of physical activity, and it's a behavior which is planned, structured, and repetitive, and has the intention of improving specific outcomes. So, for example, if somebody is an athlete, they want to improve their fitness in order to run faster, jump higher, and so on and so forth. Whereas for people that have some condition like rheumatoid arthritis, the aim is to improve an outcome which relates to the condition. So people can reduce their fatigue, improve their functional ability, reduce their inflammation, and so on and so forth. So exercise is a structured behavior, whereas physical activity is any bodily movement. Can you please change, Emma? click everything so that I can. Thank you. Now, no, the previous one, thank you. Now, we know that from the evidence that we have, and we do have a lot of evidence with regards to exercise and physical activity, we know that exercise has a dose-dependent relationship with health outcomes, irrespective of the health outcome, all the health outcomes. What does this mean? It means that the more exercise we do, either higher intensity or more times during the week, the better the outcomes. This means that if we do physical activity, we will have some specific improvements, whereas when we do exercise, which is planned and requires these higher intensities, we will have even more benefits. So the more we do, the better it is. And I have included here some examples of different types of intensities, and we can see that light physical activity is slow walking, because not everybody can do the exercises either we saw in the video or the exercises that some suggest. Everybody has different needs and everybody has different preferences, and they can do different things as well because of their functional ability. So there are different types of intensities, and you can see here that we have light, moderate, and vigorous intensity in physical activity and exercise. Remember that as a rule of thumb, the more we do, the better it is. Light physical activity is slow walking and domestic chores. Moderate is brisk walking and gardening as well. Whereas vigorous activities, playing sports, gym-based exercise activities, and so on and so forth. Can you please change the slide, Emma? Now, it is very important to mention that exercise is safe in people with rheumatoid arthritis. We have many, many studies, and there are more studies being done as we speak, that demonstrate very, very clearly that exercise is safe for rheumatoid arthritis. There's no evidence at the moment in the literature demonstrating that exercise has any type of adverse effects. For example, some cardiovascular complications or injuries or strains and so on and so forth. And this is because, of course, most research studies do well-controlled exercise programs in people that have rheumatoid arthritis. So at the moment, we are certain that exercise is safe for people with rheumatoid arthritis, and that's really important to know. In this slide here, you can see the benefits that we see through research studies with regards to exercise. So, and these are specific to people that have rheumatoid arthritis. So if somebody that has rheumatoid arthritis starts exercising, they will have these very specific benefits. So what we see is that people have, they increase once they start then exercising, when they engage in physical activity. We see increased aerobic capacity, which means our fitness. And what our fitness means, a term that we use in research, is cardiorespiratory fitness. My cardiorespiratory fitness will increase if I start exercising. If we break down this word, we see that the first bit of the word is cardio, and the second is pulmonary. So if I'm improving my cardiopulmonary fitness, my cardiorespiratory fitness, this means that the way my heart and vessels work improves, and also the way my lungs improve. So, and this is a really important beneficial change that we see, not only in rheumatoid arthritis, of course, but in any population. But these things that I'm showing you here come from studies specifically for rheumatoid arthritis. When people with rheumatoid arthritis engage in exercise programs, we see significant improvements in muscle strength. And as a result of that, when we increase our muscle strength, we can do things more easily. We can carry shopping bags more easily, stand up from a chair more easily, and so on and so forth. One very important outcome that reduces, which is a patient important outcome according to the literature, is when we start exercising, we reduce significantly our fatigue. So I'll come back to that in a bit. Also, there's very good evidence demonstrating that once people start exercising, they reduce their inflammation as well. There are very specific biological pathways that we have investigated with my team. Me and other teams, of course, around the world have investigated the effects of exercise on inflammation. And there's very good evidence that inflammation decreases in response to exercise and physical activity. As a result of that, we see decreases in disease activity as well. We see improvements in functional ability. People tend to move better, move more, and so on and so forth. And very importantly, we know that we know very well that rheumatoid arthritis, people living with rheumatoid arthritis have an increased risk for cardiovascular disease, for heart disease, and we see significant reductions in the risk for cardiovascular disease with exercise, because when people exercise, people with rheumatoid arthritis, they reduce their blood pressure, so hypertension reduces, cholesterol reduces, blood glucose, which relates to diabetes, reduces, and so on and so forth. So it is also really important to understand that if I go and exercise, if I have rheumatoid arthritis and I go and exercise, I will see all these improvements that you see in this circle. So one stimulus, exercise, if we consider exercise as a stimulus, we can see that just with exercise, we can improve all those things in people with rheumatoid arthritis. And one of the things that I mentioned before that I'll get back later to is the when we ask people with rheumatoid arthritis, why don't you engage in exercise? One of the frequently mentioned barriers are that I cannot do it because my functional ability, I cannot move very well, which is functional ability. So functional ability is low, so I cannot do more, is what they say to us. And I feel fatigued, because we know that up to 70% in people with rheumatoid arthritis do experience fatigue. It's really important to understand that these are the two symptoms that improve the most once we start exercising. When I become more fit, I'm less fatigued. And these are results from collective studies, and we have done these kind of studies in the past. We have published with my team in 2016, 2017, if I remember correctly, a review research study which looked at all the studies together and showed very clearly that when people with rheumatoid arthritis start exercising, they reduce their fatigue. So we see a lot of benefits, and we see benefits that happen all at once, not with just one session. It needs continuation. Of course, we need people to get engaged with exercise to experience all these benefits, as I will show you in the next slide. Please, Emma. Right. What I have done in this slide here is I have taken, first of all, in 2018, because of recognizing the importance of physical activity and exercise in the management of rheumatoid arthritis, the European League Against Rheumatism published recommendations about physical activity. Also, other recommendations from EULAR, for example, for managing pain, managing cardiovascular disease in people with rheumatoid arthritis, they also suggest that exercise is a very important and effective intervention. So what I've done in this slide, I wanted to show you when these benefits happen. So what I've done is I took the EULAR recommendations, the published recommendations from 2018, and I've put them on a timeline. So you can see at the bottom, I have the months. With green, we have aerobic exercise. So if I go and walk, if I go and swim, if I cycle, run, jog, all these are considered aerobic exercises. And what Ayesha showed us in the previous session are the strength exercises. So if we do aerobic exercises, if somebody who has rheumatoid arthritis does some kind of aerobic exercise, walking, jogging, swimming, we start seeing benefits around 3 months, at around 3 months. So people start feeling benefits in the green things that you see in the second box, which is VO2 max is cardiorespiratory fitness. So the way, the function of the lungs, the function of our vessels, our arteries, and the function of our heart improves quite significantly. We see a significant reduction in cardiovascular disease risk at 3 months, and also reduction in fat mass. On the other hand, when we do strength exercises like the ones that we saw in the previous presentation, we start seeing benefits as early as 2 months. And what we see improvements in strength, functional ability, which means we start moving more, and reductions in pain. And also we see improvements in muscle mass and reduction in fat mass around 6 months. When researchers follow up people who took part in an exercise study, they stopped, and then they reassessed these people 6 months after they finished with their exercise intervention, they could see that these benefits continue up to 12 months. So people who stop exercising, after 6 months of stopping to exercise, we do see that they still have improved quality of life, functional ability, and muscle mass. So in total, if I can summarize, the improvements that we see in all these outcomes in response to exercise the improvements are approximately 20 to 30% in 8 to 12 weeks. And you know what? This is exactly what we see in people who do not have rheumatoid arthritis. This is what we see in people who are 50, 60 years old, and they do not have rheumatoid arthritis, and we consider them as the healthy population. Why is that? This is because exercise is a very specific stimulus. When I'm going and exercising, I am asking from my body to run faster, to do something with intensity. So my body needs to adapt to this specific stimulus, and it needs to improve the way the heart works, the way the vessels work, the way the lungs work, and all those things that I mentioned before. And as a result of all these improvements, we see reductions in inflammation, reductions in pain, reductions in fatigue, and all those outcomes which are important for patients themselves as well as clinicians. Can you change, please, Emma? Not only exercise is good, but sitting down is also really bad. We've done some studies and we showed that when we sit down for extended periods of time, this results in changes in the way the vessels work. So if we sit for a prolonged period of time, the function of the vessels deteriorates, but we also see that we increase our cardiovascular disease risk. So not only it is important to exercise, but it's also important to sit less. And what I've done in the last 3 slides is provide some, can you please change, Emma, is I've provided some tips on how to increase physical activity. And the last 2 slides are 2 very simple examples of how we can increase our physical activity. Now, how do we increase physical activity? How do we engage in exercise? It's important that we have our rheumatoid arthritis well managed. It's very unlikely that somebody who is in pain, who feels fatigue, will start exercising then. This is absolutely understandable. We need to start thinking of sitting less. This, of course, includes myself, because I'm always in front of my computer and I need to think that, you know, I've been sitting for a prolonged period of time. So I stand up, I move around in order to break this the time that I spend sedentary. Like everything else, we need to try to make these changes today, not tomorrow. Tomorrow is, you know, a very good excuse for all of us who, for any reason, we don't engage in behaviors that are beneficial for our health. We need to walk more. We don't need to go to the gym. As you saw in the previous video, there are lovely and really nice exercises. I have got Tracy demonstrating as well, which is really nice. Thank you very much, Tracy, for that. We need to walk more. You know, this is not expensive. You just open the door, you go outside, and you walk in the speed that you feel comfortable walking. I have some examples later on. you can try safe and new physical activities. Swimming is one of the activities that people with rheumatoid arthritis actually love. It comes up very, very frequently as a favorite physical activity. Dancing, other water-based activities such as aqua aerobics. And it's really important to start slow and build up the intensity, because remember that exercise and health have a dose-dependent relationship. The more we do, the better it is for us. So we can start low and try to build up. Very importantly, listen to your body. If you have pain, if you feel you cannot do something, don't do it. It's really, and I know that I have some questions related to that as well. There will be questions around that. I've seen some questions that you've sent to Emma, and I will be able to respond that better when we come to the questions. And one of the things that is suggested by behavioral psychologists is that we can use outcomes to monitor progress. So if we use, for example, a simple pedometer which costs about £5, we can record how many steps we are doing today or tomorrow when we start walking, monitor that, and try to beat this number. It acts as motivation for us to engage in physical activity. Next one, please, Emma. So how can we actually do that? The first thing is that we need to, start thinking how we can break the sedentary behaviors. We need to, it's really important that we break these kind of behaviors. So every 20 minutes of sitting, stand up and take a few steps. That's very easy. You can actually put the remote control away so that when you want to change the channel, you stand up, you change, then you sit down. Wash dishes in 3 goes. These are very simple things to do, which actually work. Stand up and sit down 3 times every 20 minutes. These are, as I said, really practical things that we've seen through research that can change our sedentary behaviors for the better. And my last slide, I focused on aerobic exercises because I knew that Ayesha would be doing strength training exercises. And if you want to start doing more physical activity, you can start by going for a walk, for a slow walk, week 1, let's say on Monday. You can start walking 10 minutes, 3 times a day, slow walk. During the second week, you can carry on doing what you did in the first week. Do what you feel confident about, or you can progressively work up. So in week 2 or 3, you can increase 10 minutes to 15 minutes of walking 3 times a week. And then try to build up so that you reach 30 minutes 5 days a week. Why do we say 30 minutes 5 days a week? Because these are the recommendations for physical activity. And when we hit this cutoff point, when we do actually 150 minutes per week of physical activity, then we start seeing real benefits. You don't have time. You can go for a brisk walk, which is a significantly reduced amount of time engaging in physical activity. You can go for, during week 1, brisk walk for 3 minutes, 3 times a week. During your second week, you can either do what you did in week 1, or you can actually build that up if you feel confident, if you felt okay, and so on and so forth. You can do 3 minutes 4 days a week and progressively build up to 3 minutes of brisk walking every day and carry on doing that. So these are really practical tips in order to help you engage with physical activity. It is recommended, of course, that you increase your physical activity because we see all these benefits. And I've personally seen these benefits within the gym, and I've seen how people can benefit from becoming more, people with rheumatoid arthritis becoming more physically active and engaging in exercise and physical activity. And with that, I would like to thank you very much for your attention. I've got another slide, which is funny, so you have to put this on. I like this slide. we can break and we can have a chat later, or we can, you can ask me questions now, or however you want to do this.
Thank you so much for that, George, and I definitely agree with that little quote at the end. We are now going to go on to the Q&A session. So I'll just ask George to unmute. Like I said before, we had some pre-submitted questions, but if you have any other questions that you think of throughout the Q&A, then please put them into the chat to me and I will ask George. Okay, so one of the first questions we had was, doing exercise at home is a lonely experience and so many classes have been stopped during COVID. Can you recommend any online Zoom classes that are safe and effective for RA sufferers?
Like we've heard today, there is a lot of information on the ENRA's website about safe exercise to do at home. And also we've seen a video from Ayesha just before my presentation. So I think this is a really good starting point, because I'm not aware of any rheumatoid arthritis specific online exercise advice or exercise strength training exercises or aerobic type of exercises. So I wouldn't recommend anything that I'm feeling uncomfortable with. The only thing that you can have a look at is the ENRA's website. That's what would be my recommendation. One of the main issues why people with rheumatoid arthritis do not engage in physical activities, first of all, because there are no classes everywhere that know how to exercise people with rheumatoid arthritis. There's no regular support in the way you want to be supported.
And I'll just come in on that as well, George, to say that part of the idea of these virtual groups that we're hoping to set up with NRAS is to get these special interest kind of groups going, and that will be one of them. So do get in touch and be watching that. There might be that there'll be a group of people who are really keen on doing Tai Chi together as a group online, or there might be seated yoga.
Another question is, should I manage at least a few minutes of gentle exercise whilst having an extreme flare, or am I making it worse?
That's a very good question. I do have experience from that, because as I said, I've been in the gym with people that have rheumatoid arthritis, and this was a very frequent phenomenon. People would have a flare, they would call and say, I have a flare, can I come into the gym, yes or no? I did still recommend people to come into the gym. However, one of the things that we did was, if the flare was and affected mainly the knees, we would exercise at very low intensities the upper body, and vice versa. So I would still exercise people who had the flare by not exercising the joint that had the flare, other joints, very low intensity. However, this was done in a controlled environment with people who knew what they were doing, with exercise professionals that knew what they were doing. So when you have a flare and you have pain in your knee, ankle, or hip, you shouldn't be going for a walk. You should be doing upper body exercises at very low intensities if you want to keep on exercising. I know I'm not answering the question directly, because everybody is different. Everybody has different kinds of flares, and the pain can be variable. So it needs very specific advice tailored to the individual, rather than, for me, something to say yes or no. So it was a generic answer.
Great, thank you. And I assume that you just kind of do as much as you can within your limits is still beneficial.
Absolutely. That's a very good point. And I just mentioned that in my presentation, that just follow your body. Just when you know that you've done enough, you can stop. However, as I said, with people with rheumatoid arthritis in the gym, there is a certain limit that you can push people above their limits. And once they start feeling confident that, oh yeah, okay, I can do that, and they start seeing the benefits of going the extra mile. As we said before, exercise has a dose-dependent relationship. The more we do, the better it is. So once they pass this barrier, that it gives them more confidence, and they can do more. That's what we've seen. That's what research shows.
Great, thank you. I have another question of how do you motivate yourself to exercise when you also suffer with terrible fatigue?
Yeah, that's a question for all of us. Terrible fatigue, not so much, of course, but we all feel fatigue during the day, and it's a behavioral thing. So one thing that we need to remember is, and I mentioned in my presentation, and I did mention that in my presentation, is that fatigue is one of the barriers mentioned by people living with rheumatoid arthritis for not engaging in physical activity and exercise. But what we see is once they engage in exercise, this is one of the things that improves the most. I'm going to say it one more time. Exercise has a dose-dependent relationship. The more exercise you do, or the higher the intensities that you do when you exercise, I'm not recommending go out and run. I'm not doing that. I'm just saying that we progressively build up. But once we do higher intensity exercises, fatigue will be reduced even more. There's excellent studies showing that, and there's collective studies with collective evidence over the last 20 years that demonstrate exactly that. Fatigue reduces in response to exercise. So it's a paradox. We don't do physical activity because we are fatigued. We start exercising, fatigue reduces quite significantly. And fatigue is a very common symptom in rheumatoid arthritis.
Great, thank you. You also said in your presentation about either doing like a longer walk if you don't have time to just do a quick brisk walk.
Exactly.
Someone asked, is it best for a small but few walks or one long walk per day?
Whatever rocks your boat is the answer to that. But it is important that we start slow, we start less days a week, and we progressively build up. That's very important, because I think this helps people build their confidence as well. Just very little. What I said in my presentation is, if you don't do anything, just go for a very slow walk 3 times a week, or go for 2 times a week. And then the next week, go for 3 times a week. The week after, from 10 minutes, go 12 minutes, 3 times a week. Try to build it up. Try to build it up to have to try and reach 30 minutes, 5 days a week.
Great, thank you. We've had quite a few questions come in saying, what are the best types of exercises to do for RA? And also, are there any particular exercises that we shouldn't be doing?
The only exercises that you should not be doing are the exercises that are causing pain to your joints. If you have a joint which is affected by rheumatoid arthritis and you have pain in a specific joint, you shouldn't be exercising this particular joint. That is what I mean, not exercising. It's not, we should not be, let me give you an example. We had a gentleman, of course, I'm just giving you a case study here. One person does not make a rule. Okay, we need to remember that. But we had a gentleman in one of our studies who was due for 2 knee replacements, one in 3 months and the other one in a year's time, because his joints were really damaged. And we talked to him about the exercise study that we were doing back then, and he said, yeah, fine. And he was adamant that he didn't want to do the surgery, and he wanted to start exercising. Consultants said no. We were in very close communication with the consultants, of course, in Dudley. And we said, okay, just postpone they said, okay, fine, if you want to do it, because it was his will to do it. We said, okay, let's postpone the surgery. Let's start with light physical activity. So we did light physical activity. We did build this up. So eventually he didn't do the surgery, because this was a 6-month exercise trial. He did, I think, the surgery 2 years after. Again, I'm not saying don't have your surgery. That was one case study. What I'm saying here is that when we start exercising, our body becomes stronger, our joints become stronger, and they are able to, because the muscles become stronger, they're able to support our joints better. And that's one of the reasons why pain reduces in response to exercise. We know that pain reduces in response to exercise as well. So this is one of the beneficial adaptations as well. I completely forgot the question. I've been talking, I completely forgot the question. Can you ask the question again?
Yep. It's what exercises can we do with RA, and what are there any particular exercises that we shouldn't be doing?
Yeah, it's the right answer is do whatever you like doing. Start from lower intensities, build up to higher intensities progressively, knowing that what you're doing does not cause any damage. There's no right or wrong. It's better, in fact, if you do something that you like, because it's more likely that you will engage in this type of physical activity. And it's also what I've, based on focus groups, it's people also like to change every now and then. So, do 6 months of Aqua aerobics and then go and do a dance class for another 6 months. Things like that.
Thank you. And I suppose this one kind of leads on from those last ones. What adaptations can we do for those with locked wrists or weak ankles?
What kind of exercises you can do? I mean, a weak ankle is a very broad term. I guess that would mean that, a weak ankle, what does this mean? Is there pain in the ankle, or you feel the ankle loose? These are two different feelings. The first one, if you have pain, it's a different story. If there's damage in the ankle, you should not be doing, and if it's painful when you walk, you should not be exercising this ankle. We said that before. But if you have this loose feeling, you should be walking. And there are supportive brace ankles and things like that. There are strengthening exercises to increase the range of motion and the strength of the joint, so that you can, with a physiotherapy, so that they can support you then to do physical activity. There are some people that have to go to a physio first to improve the range of motion in order to be able to engage in physical activity, walking, classes, and so on and so forth. But as I said, everybody's different, and everybody, all the exercise programs have to be tailored to somebody to be, absolutely effective. But there are, online, like ENRAS, the online courses and suggestions, and what we've seen before from Ayesha is a very, very good starting point. Very good starting point.
Mm-hmm.
And the only recommended one, in fact, because there are so many videos that we can see on YouTube with wrong techniques, and because the internet is a platform where everybody can post whatever they want, of course, and that's one of the main. It's a big issue from whichever angle you're looking at it.
And just coming in on that, George, I think that's why quite a lot of people with RA quite like hydrotherapy or Aqua, because you're not putting too much, you've got the sort of buoyancy of the water to support the joints a little bit, but getting that range of movement. But of course, donning a swimsuit and hopping into a pool isn't everybody's cup of tea. But even doing some walking in the water, I believe, is quite good, and that again isn't putting too much. So if you have those weak ankles, perhaps that might be something to try.
Absolutely. And as I said, Claire, this aqua aerobics activities inside the swimming pool is something that comes up very, very frequently. And in fact, you're absolutely right. It can be actually an intervention to improve your range of motion, so that you can do land-based physical activities such as walking and other things.
Great, thank you. And to go back to what you were saying about the surgery, I know you said it was just obviously the one-off case, but someone asked, could exercise be beneficial in post-surgery recovery times?
Not right after surgery, but once the surgery is done, there's no evidence around that. There's no studies that have actually, after after people with rheumatoid arthritis, they have surgery, when it's safe to do exercise and what kind of exercise. There are no studies around that. So the safe thing to say here is, once you have your surgery and you start feeling well and you're able to move without pain, then it's the time to start exercising.
Great, thank you. You also have another one saying, if I exercise too much one day, then the next day I'm absolutely floored. Why does this happen?
It happens to all of us, I can guarantee you that. It happens. Yesterday, what I did, I was gardening. I was digging in because my wife wants to have tomatoes in the garden. I want as well, but I just blame my wife for that. So I was digging yesterday, and it was exhausting. I thought it would be easy, but it was completely exhausting. So yeah, it's.
Now we know, George, that you're about to add to your family, so I would have thought you'd be resting, preparing for those long sleepless nights that might be lying ahead instead of digging in the garden. But I suppose it's because you're using muscles that you don't normally use, doing a different type of exercise, and that's why, as you were saying earlier, little and often is probably best. There is another question, if you don't mind, Emma, that I saw had been posted earlier, was about the use of painkillers and inflammatories either ahead of exercise or to help you exercise. And that came up in our little chat room during the break. Somebody, beautiful day, went on a really nice long walk, and of course then for the next 2 days was laid low because she was in agony. So is there a role for using of pain relief in planning your exercise?
In fact, this was a this was a topic that I've written an editorial with Professor George Kittas, a consultant rheumatologist as well, after one of my EULAR talks. No is the answer, simply because we know that pain is a barrier for starting to exercise. But there's no reason there are no studies, so I cannot, whatever I say may be completely wrong. But the evidence that we have so far from other studies, the side effects of medication, and the fact that when we start exercising, we reduce our pain, seems to be, making the usage of painkillers not necessary. I wouldn't recommend it. We wrote an editorial and we spoke to people and we looked at the evidence. We don't support it at the moment.
Okay, that's really useful, because it's something that we've heard in the past about, if you think you're going to have a very active time, sort of build your paracetamol or your inflammatory up beforehand so that it gets you over that hurdle. So that's really interesting. Thank you for sharing that with us.
And the two things that we have been discussing with other researchers was, okay, how do we beat pain in order to help people with rheumatoid arthritis start exercising? This can only be done at the moment with tailored exercise programs. If there is pain, somebody needs to see the physio to improve the range of motion, start feeling less pain so that they can engage in exercise. Taking more medication doesn't do any good. The other thing that we've been discussing is about fatigue. People feel fatigued. And one of the things that we are thinking of investigating is, if we drink our coffee half an hour before the session, or if we take caffeine half an hour before we go for a walk, is this beneficial? Is it not? We haven't, there's no research again around that, but we are trying to find natural ways of helping people to engage in physical activity rather than try the, medication.
Yeah. Makes sense.
Thank you. We've had actually quite a lot of the same question. One was pre-submitted, and we've had some in the chat as well, about whether running is a safe activity. People have had, different advice, and does it impact the damaging of the joint any further?
There was an excellent study in 2003, which was called the RAMIT study. RAMIT study was done in the Netherlands. And what they've done is they did have cycling and jogging, and they looked at the effects of exercise on radiological damage. So they looked at X-rays before and after 6 months of exercising. And one of the things that we know from that study, it was an excellent study, very good methodologically. So it provided very robust data. It showed that exercise can actually slow down the radiological damage that is caused by rheumatoid arthritis. So that was a really good finding. That's very relevant to this question, because if you can run, you can run. If you start jogging and you can actually manage it without any pain, just do it. Don't overdo it. If you want to start jogging, you can start by doing, again, as I said in my examples, do it for 10 minutes. Next day, see how you feel. The day after, see how you feel. Allow 48 hours. Whenever we start exercising, there is pain the next day and the day after. This is called, actually in sports science, delayed onset of muscle soreness, DOMS. So everybody who starts exercising, if I go and do some weights today, tomorrow I will feel pain in my muscles. This is a very normal thing that happens in my muscles, because I'm giving my muscles a stimulus. I'm telling my muscles, you need to lift these weights. So my muscles, in order to become stronger, they destroy themselves. So there's some very minor damage in my joints. If I do today 20 lift ups, such as the ones that we've seen on the video, perhaps tomorrow I will have pain here because I've put a lot of strain in my muscles, and the muscles will have to adapt to that. They will have to become stronger. This is expressed 24 hours and 48 hours after the exercise with pain, but it's a necessary and normal thing to happen.
Thank you. We've had some questions. So people have said that they've got lots of problems with their back or neck. How do I protect my back from getting worse, or what kind of exercises can we do to help that?
I've got problems with my lower back, and I've got 2 cysts in my neck, so I can relate myself to that very, very closely. At the moment, the only evidence to reduce low back pain and neck pain is muscle strengthening exercises. But these have to be discussed with the physio, and they have to be tailored to the problem. So we need to strengthen the muscles. As I said in the presentation, we need to strengthen the muscles around the joint, either is the neck or the lower back, because this does actually make a difference, and I know that from experience.
Great, thank you. We have another question. Do you have?
Sorry. I said that from experience. But as I said, it's not my experience that I'm saying here. I'm just providing not opinions. I'm just providing what comes from the data that we have. So what comes from the data that we have is that muscle strengthening exercises. This was based on the data that we have, not my personal views.
Great, thank you. Someone's asked, do you have any advice about pacing? Said it's the bane of my life, and I just can't seem to get it right.
Welcome to join the club. Welcome to everybody has this. Pacing is a completely different story. Sports scientists have been doing years of studies in terms of pacing. The question that I would ask the person who cannot, keep on with a certain pace is, I would have to break this down. Why does this happen? Is it because of pain or is it because of fatigue? And what we can do is, when we increase the intensity of the exercise, so for example, if I go now for a slow walk and then I feel like, okay, for 3 minutes, I'll go for I'll increase the intensity. My slow walk will become a brisk walk. When I start that I feel fatigue, when I start feeling fatigue, or when I start that I cannot keep on with the pace, you can actually reduce the pace, or you can carry on with the pace for another few seconds to see if you can manage it. Don't overdo it. What I'm advising always is not to overdo it. You can exceed your thresholds by a little bit. So you start feeling fatigued, push yourself another 5-10 seconds. The next 24 hours, see how you feel. Because if you don't break these barriers that you have in a safe way, just little by little, that's the important thing. And that's what I've seen from practice, and that's what research tells us. You know what? There are studies in people with rheumatoid arthritis that are high intensity. 90% of the maximum. So we would take, for example, people with rheumatoid arthritis, we would put them on a treadmill, ask them to walk as quickly as they can uphill. And then at some point they say, I had enough. That would be 100% of this individual's fitness. We would give them in fact, we just finished a study, a 3-month study, where we had 90% of maximum. So we've done in people with rheumatoid arthritis a very high intensity program, but somebody was in the gym with them, instructing them, asking them how they feel, so that we can carry on with this 90%, such a high intensity of exercise. We didn't see any side effects, and the benefits were really, really good, in terms of health. We looked at how the heart works, how the vessels work, how the lungs work, inflammation reduced, disease activity reduced. And this is not something that we showed for the first time. There's a lot of evidence around that.
And just a good tip that I once heard at a presentation about pacing is, set yourself a time, and then, so if you digging for your tomatoes yesterday, just have an alarm on your mobile or something to say, I'm going to do this for 15 minutes and then I'm going to take a break and maybe go do something else, come back and do another 15 minutes. But I think that what we all fall into the trap of is when you're feeling, I'm doing okay, I'll just do a bit more and do a bit more and do a bit more. It's like, on a beautiful spring day, you might decide to go spring clean the whole house, and then of course you're down, for the next 3 days. But again, if just pacing, going, well, I'm actually going to only do this one room today, and then if it's sunny tomorrow, I might do the other room. But it's so easy to say, but it's so hard to do. But I think if you, as a technique, is to write it down, what you're going to do and how long you're going to spend doing it, and then try and stick to that to help with that pacing of keeping moving, but not overdoing it. Sorry, Emma, back to you.
Thank you. We've had a question saying, why is there so little evidence for the benefits of hydrotherapy?
Again, excellent question. There are some studies that have used actually, you mean hydrotherapy? Hydrotherapy is range of motion exercises in the pool, which is different from actually, it's range of motion exercises. One thing that we need to keep in mind is that my presentation today was not based on range of motion exercises. So hydrotherapy is not physical activity or exercise, is range of motion. Physical activity or exercise would be walking inside the swimming pool, swimming, doing aqua aerobics, something that will bring your heart rate up. Okay, so hydrotherapy from aquatic exercises is different. Okay, so are you aware, Emma, if hydrotherapy is exercise or is it range of motion? Are you aware, or was it the question was hydrotherapy?
It just said hydrotherapy. Oh, just said someone just replied saying both. It was both of them.
Both, yeah. The truth is that there's not a lot of evidence, and sometimes we need to think of the difficulties of doing research as well. It's much easier for me to find a gym to do my research and do exercise in the gym, rather than find a swimming pool and do a research study in a swimming pool. And that's one of the main reasons why we don't have so many studies in exercise, aquatic exercise in the swimming pool. But the evidence that we have is very convincing that it's a very safe method of exercise. People with rheumatoid arthritis really like it, and it works for their benefit as well.
Thank you. And I think we probably have time for one more. Evidence shows that despite treat to target strategies, the muscle loss that is experienced in RA has not improved. Presumably, it's only exercise that can rebuild the lost muscle.
That's that's an area of research very close to me, because this is, I started from investigating what we call rheumatoid cachexia. Rheumatoid cachexia is a term that we use. I've written one piece in the ENRAS magazine as well. That was 1 or 2 years ago. And what we see in people with rheumatoid arthritis is that the weight remains the same, but the body composition changes, which means that we tend to gain fat mass and reduce our fat mass or muscle mass. So people with rheumatoid arthritis stay at 60 kilograms, for example, but 3 years after having rheumatoid arthritis, they will have reduced muscle mass and increased fat mass. And that's something that we see very frequently. And this is a term that is called rheumatoid cachexia. There's a lot of studies around that. One thing that has been suggested is that it's the proteins that are produced in response to rheumatoid arthritis that are causing that, particularly TNF-alpha. So we in our lab have studied, and some others, the effects of anti-TNF medication on body composition. It doesn't do anything. The only beneficial thing that we know for certain that can reverse these adverse effects is exercise, particularly strength types of exercises. So that's absolutely correct as a statement. Medication cannot reverse the changes that we see in people with rheumatoid arthritis in terms of their body composition, their fat mass, and their muscle mass. Only with exercise we can change these things.
Great, thank you so much, George. Thank you to everyone that put in the questions. Apologies if you didn't get to yours. We actually had quite a few coming in. So apologies if I missed it or just didn't get around to asking it. So I think that brings us to the end of the event. Claire, do you have anything else to add?
I just wanted to say thank you so much, George, for a really fascinating presentation, and thank you for giving so much of your time when I know you've got your hands full there, and I wish you all the very best on a personal level for the new addition to your family due to join you very, very soon. We were glad it didn't happen in the middle of this presentation. That was good. And best wishes to your family and your wife as well. Thank you all for some really fantastic questions. I hope you found that helpful. Thank you very much indeed. And stay safe, everyone. And let's hope we won't be too long before we'll be able to get back to some face-to-face activities as well. Thank you.